Hello, I'm Bill Reiner. Again, I haven't changed. Child psychiatry and urology. And I want to talk a little bit more about navigating relationships with the kids with exstrophy. We've talked about the basics of that in a previous talk. And what I'd like to do, I'm going to look at this horizontally, meaning I want to start with the younger kids and talk about their relationships as they deal with them in terms of dealing with friends and then dealing with peers and then dealing with school kids, and then going on to talk about how they can deal or the problems they may have with adults, especially with teachers. Not that they're going to have more trouble with teachers, but that is a big part of their adult life. And then talk about relationships in the younger kids with doctors and nurses. And again, I think it's important that I stress for any age group that personality, the child's basic personality, is going to be very important in how that child navigates any series of experiential situations, whether you're talking about relationships or social situations or anything they go through in life. And personalities, we pretty much come into the world having, they can be buffeted. We all can be buffeted by experience and can experience alter personality. Well, experience can be reflected in personality more seriously in some people than in others. Some people have a much more, I guess for lack of a better way to put it, rigid personality, a more structured personality that always shows. Some people might seem that their personality changes based on experiences, severe difficult experiences, but I think really what's happening is you're seeing a change in their affect or their mood or their anxiety level, and that can make people look different when they really aren't so different. So I think it's important to recognize that each child is going to be different, even in the same family. Each child can have completely different personalities, or some families, the kids are fairly similar in personality, just variable from person to person. So if we talk about the preschool and early school age kids, say roughly 4-year-olds up to about 8-year-olds or so, the primary relationships outside of parents and extended families is the relationship with peers, and really relationships with friends, because young children learn how to develop friends, they become friends, and over time, with help from mom and dad and other parents who are in the area, they learn how to relate in ways that are functional and useful, and they aren't beating each other up and causing problems and so on. But in the preschool age, it's fairly easy, because with young kids, issues such as incontinence or wearing a diaper isn't such a big issue. It becomes a bigger issue, however, as the kids get older. So as the kids get older and reach into the 4, 5, 6-year-old age group, they begin to realize that their peers, their friends who are roughly the same age, are not wearing diapers anymore and will stand to urinate if they're boys or sit to urinate if they're girls, but they'll do this on their own. And each of these kids with exstrophy will realize that that doesn't happen with them. So there are going to be issues of realizing that they're different, and that is a word that's commonly used by kids with exstrophy. And as I've said before, they tend to think of being different as though they walk around with a scarlet letter and a giant D on their forehead for different. Of course, the truth is that if they're walking around, nobody knows they have exstrophy, nobody knows they're incontinent. As a matter of fact, nobody knows much of anything about them except what they see, which isn't going to be a whole lot, mostly their clothes and their hairstyle perhaps, or for the older kids, their hair color as they change those things. But nevertheless, the child with exstrophy thinks that they're different, and therefore the image of themselves is of being different, and they tend to relate to their friends and their peers, at least in some situations, as though they're different. So they tend to learn to protect themselves. There's nothing wrong with that. But I think it's important to realize that the differentness, being different, is more in their head than real. The child, I think, needs to be coached by mom and dad, not to mention their doctors and nurses who can coach them in this. that their condition, including their incontinence and whatever issues come up around that, are private issues. Lots of things about all of us. Each of us is private. Some of us want more things to be private than others. Some people are very open. Some of us are not open. It really doesn't make any difference. That's a personal issue. But I think it's very important to realize, and it's very important to start early with kids with exstrophy who see themselves as being different, which is nearly inevitable, that yes, they can be private, and perhaps they should be private. At least most kids are going to want to be private, but they don't need to be secretive, meaning if their friends find out that they're wearing a diaper, they need to have some coached adaptive technique, some coping mechanism to be able to deal with it, which won't be easy the first few times they use that technique if they need to use it. But it needs, and it can be practiced at home, but it needs to be available to them so that they realize that if one of their friends finds out that they wear diapers when they're 6 years old and nobody else does, it's not the end of the world. They're not going to fall over dead. They're not going to grow horns on their head. And their friends are most likely to put up with it and think it's a little weird. But once they find out that they have something unusual, like a bladder that leaks, the kids are by and large going to move on and do what they do, which is to interact and play and develop a relationship with each other. But that's not how the child with exstrophy is likely to see it. Most kids with exstrophy are really afraid of that kind of discovery. So we have to help them. And sometimes parents are very good and very natural, good meaning natural, at helping kids to deal with that. Many of us, perhaps most of us, aren't so good necessarily at that. So we'll need some coaching ourselves. And I think generally our urologist and people that work with our urologist are going to be very helpful in terms of helping us work on coping mechanisms, realizing that coping mechanisms that work for one child or even a group of children may not work for all. So you're going to have to be able to adapt and continue to adapt based on your child and his or her personality, just as your child is going to have to learn to adapt to their own personality and adapt their own personality to coping strategies for different situations.